I'm Dr. Katie from Scribenote. Today I have Dr. Amari with me, and we're going to chat a bit about what she does. So introduce yourself, Dr. Amari.
Hi, so yes, I'm Dr. Amari Patel. I'm currently working with a practice called VetGo or VetGo Mobile Veterinary Services. I graduated from OBC in 2022 and have been almost exclusively working in mobile practice since I graduated. And it's a bit of a niche practice as well, other than being mobile. I get to see cats, dogs, and my main passion is that I get to work with birds, specifically backyard or pet poultry. So chickens, ducks, geese, and everything in between.
Amazing. Wow, that's a big jump from school directly to mobile. And you're on your own most of the time, right?
Either on my own or if I'm lucky, sometimes I do get to work with a RVT.
Oh, good for you. That's must have been a pretty challenging transition. I know I needed a lot of support when I was first out of school.
Yeah, it was definitely a steep learning curve because when you're in mobile versus a brick and mortar practice, you are very much on your own. I did have my mentor, a vet at the time, come out with me on calls for maybe the first week that I was out. And then after that, I was on my own, and she was really only available to mentor me over text or phone.
Yeah.
So that's obviously a lot different than having someone in the same building as you, being able to bounce ideas or thoughts on cases off of them kind of right away. But it's, I still much prefer it to brick and mortar practice, which I did do a little bit of.
Yeah.
And yeah.
Awesome. I guess what I was going to say was, you're always in front of the client, so you learn a lot about how to deal with people directly and how to get them to help facilitate what you're doing. So it's a really good skill, I think. Yeah.
Yeah, it really puts you on the spot.
Yeah. So, what is it like working with backyard birds? What kind of spurred your interest in that?
So I've always had an interest in working with birds. During my undergrad, I did research in commercial poultry behavior and welfare. So that's kind of what got me into the world of poultry. And then during vet school, I was definitely gearing up to be more of a commercial vet, so working on the large scale production farms. But then I bumped into this mobile practice that was doing, majority backyard pet poultry and birds, as well as cats and dogs. And I did a week with her, just shadowing her during a summer, and I absolutely fell in love. The fact that backyard poultry medicine kind of focuses more on the individual birds, kind of as pets. So it definitely kind of goes more into avian and exotic pet medicine rather than kind of commercial bird health. So that's been a really rewarding career that I found myself in.
Amazing. And you have your own birds, some in-house and some outside?
Yeah, I've got six little parrot type birds, so conures, lovebirds, that sort of thing. And then I've got three backyard chickens as well.
Awesome. What do you think is the most common, I guess, like illness or ailment in like backyard birds? I know obviously it's quite like been quite a boom of backyard flocks in our area, especially since
Mhm.
COVID.
Yeah. Sure.
So more and more people getting backyard birds, and yeah, what do you see a lot of?
I guess off the top of my head, the top three presentations or complaints I would see are number one being chronic reproductive disease. So whether it's like ovarian or oviduct neoplasia is a big one. Usually presents as, oh, my hen is egg bound. She hasn't been laying eggs and looks really off. And then the next one would be chronic upper respiratory disease. So things like mycoplasma, where chickens get like really swollen or foamy eyes and a little bit of other upper respiratory signs as well. And then I think the next biggest one would be bumblefoot, so sores on the feet from usually a little bit of husbandry deficits or just bad luck.
Yeah, yeah, or heavy birds, right?
Yeah.
Yeah. So I guess one thing is we've seen a lot more of our colleagues getting backyard flocks. So if anyone who's listening to this had an interest, what would be your like main tips that you could give them when considering, getting a few number, like, small number, but obviously we know about chicken mass, so maybe a bigger herd of or flock of birds. Yeah, what would you tell them?
My number one thing would be check your local bylaws, make sure it's okay for you to have them and how many you are allowed to have. Not that anyone really comes knocking and checking, but you never know. And the second big thing is either familiarize yourself with just the basics of avian anatomy and medicine at home, or if that's something you're not really comfortable with, make sure you do have either an avian experienced vet. It doesn't have to be a specialist. There aren't very many of those in Ontario, so I do understand, the difficulty there. But either someone you can directly take the birds to, or someone that offers telemedicine for avian and exotic services is much better than having no support at all.
Those are really good points for sure. Yeah, especially with drug withdrawal times and things like just to know, especially if you're going to eat the eggs or anything like that, right? So really
Yeah.
important.
Mhm.
And then, yeah, the potential for bringing in diseases if you're adding birds to a flock and things like that. Oh, that's what I was going to ask you. I knew it'd come back to me. Any websites or textbooks that you would recommend for people?
For vets specifically, or just general?
Yeah, maybe both if you have them.
So for general resources, there's a really good one by UMAFRA. It's called Small Flock Ontario. So they've got a whole website that's just dedicated to backyard or small flock poultry owners, things about common diseases. They've got lots of great webinars. They've got a very not sure 100% if it's up to date, but they've got a decently up to date list of veterinarians that again, even if they're not really specialists in avian medicine, just veterinarians that are willing to at least try and see backyard poultry. Um, as far as more vet-specific resources go, there is a really great textbook. So it's Backyard Poultry Medicine and Surgery by Cheryl Greenacre and Teresa Morishita. That's one that I often flip to frequently. Even now, if there's something I see that I'm like, I haven't really seen this before. I wonder if it's in the textbook. So yeah.
Awesome. Well, maybe what I'll do is I'll link those resources at the bottom of this chat just so people can
Mhm.
access them as well. And how do you find the balance of mobile practice? Like, are you close to a lot of the places you go? Do you travel quite far? And then, like, what's your breakdown of schedule like? And how is it? Well, you're working for a company now, but like, how is the balance that you said you did a bit of brick and mortar? So, yeah, what is your thoughts there?
So to answer the first part of that, how far will I go? Well, I think my situation again is a bit more unique because I'm one of very few, if not, I maybe I think right now the only vet that will actively go out to see backyard poultry. So that means I have to be kind of willing to go a little bit farther than most mobile vets would. In a perfect world, everything would kind of be within a half hour, maybe an hour radius, but I have clients I regularly service that are maximum an hour and 45 minutes drive away. Um, and then, of course, for more remote areas, folks that have backyard poultry in places like Muskoka and that sort of thing, or more eastern, like Ontario, like Ottawa, Pembroke areas. I do, when it's appropriate, I do offer telemedicine services for avian and backyard poultry clients as well. For cats and dogs, again, it's a bit of a range. I try and stick within about 45 minutes of my home, but currently the practice I'm with, we're fairly new. We just started up about a year and a half ago, 2 years. So we're kind of just trying to reach as many areas as possible. So I've done my hometown of Orangeville here, and I've gone to the GTA, Guelph, Cambridge area. Tomorrow I'm down in Hamilton, so it's quite a range. And then as far as the balance goes, so the thing I really like about there's pros and cons to house call and brick and mortar, but the thing I really like about house call is that I really do get to take my time during appointments. I've worked for locum for a few different house call services at this point, and I've always got at least an hour for my appointments, and that doesn't even include driving time. So I really get to know the owners really well. I get to see the pets, whether they're birds or cats or dogs in their home environment, which, is a really helpful thing to have in many cases. And especially for our higher FAS guys, you really just get to take the time building their trust, giving lots of space and then pets or treats as needed. And yeah, you just really get to be able to take your time. It's almost never feels rushed to me, compared to brick and mortar where you're often got 20, 30-minute appointment slots and it feels very wham bam, thank you, ma'am, sometimes.
Yeah, for sure.
So it's really been good for my style as a practitioner, I find, and it's something I hope I can keep.
Yeah. Well, I think a lot of people are, considering, yeah, at some point or another when you're in brick and mortar, considering like, oh, like what would it be like to be a mobile practitioner and to have my own schedule and to have a bit more time and things like that. So I think those are really great insights to share with our veterinary community. So thank you so much. I guess maybe the last thing we'll touch on is I know you mentioned you have been using Scribenote in your backyard poultry medicine and your house call medicine. How are you finding it?
I'm finding it really helpful. It has been a game changer, especially now that Scribenote recently came out with some new features like the multi-pet feature and the adaptive templates feature. Because I've obviously got very specific templates I'll use for my avian patients. So I just plug that into Scribenote and it, not to say spits out, but it generates exactly what I want it for me in just minutes. So that's been really useful, and I'm definitely going to continue using it. And I haven't used the herd function yet, but I'm sure that'll come in handy someday too.
Awesome. Yeah, I'm really glad to hear that. We've definitely tested it a lot with like small animal, obviously, but from what I've found, the adaptive templates will do kind of anything you ask it to. So tested it recently with a colleague who does food animal, and it seemed to work quite well. I'm glad to hear it's working well for backyard flocks and house call appointments. Do you just curious? Do you leave it in a pocket, or do you tend to like set it down somewhere for audio? Just I have a ton of people asking me that, so just to get like a real world experience would be cool.
I'll do either, depending on kind of how, what kind of farm or barn or home I step into and where things are.
Mm.
I try and leave it in on a surface close to where I'll be speaking if I can. So for house call appointments, I'm usually on the floor. So I find usually my head is kind of at the level of a coffee table or something if I'm seeing something like a dog. So I find that tends to pick up the conversation a little bit better, as opposed to I find when I have it in my pocket, I'm kind of, I don't even realize I'm doing this, kind of taking it in and out of my pocket, trying to speak into it when I can. And I find that's a little bit cumbersome. And the shuffling, I don't know, maybe if it disrupts the audio or not.
Yeah. Yeah, it does. It typically like
Okay.
the pocket, like the swishing, you'll hear it.
Mhm.
Like if you listen back to your audio, you might hear
Right.
that. So
Yeah.
yeah, I just wondered kind of how you worked around that in the like in a barn setting.
Mhm.
But you can always at the end quickly like give a verbal summary too if like as you get to your car or whatever. So
Right. Yeah.
yeah, but those are really good tips for our users as well.
Mhm.
Anything else you want to share with us about your general experience, or like would you try and recommend more people try and see backyard birds? Like, what do you think?
Um, hmm. I think the first thing that comes to my mind is maybe for vets that are considering making the transition to a house call practice. Um, in hindsight, maybe wouldn't have done it straight out of school. I would say maybe have at least a year of brick and mortar under your belt first. That way, you're just more comfortable being able to go out into calls almost exclusively on your own. Um, and uh, yeah, having apps like not just things like Scribenote, but obviously ways to plan out your drive and anything that might come up on your drive, even just planning your day if you do have multiple appointments is really helpful. Um, and yeah, that's pretty much all I can think of right now.
Awesome. Well, thank you so much for joining me. It's really nice to get a perspective of, a little bit of a unique niche veterinarian, and thanks for all the things you do because I'm sure so many people need it. So yeah, we'll catch up another time, and thanks everyone for joining us on Let's Up Talk. We'll see you later.